In this section, I want to demonstrate a series of movements that I have the clients do. I typically do this after I've already needled the hand points for the hips or for the low back, and when they're in supine position. So for Tai Yang, Shao Yang type patterns with low back pain or hip pain, and it may even be that the pain is just at GB 30 or GB 29, it might just be more of a pure Shao Yang pattern. I'm going to needle either Ling Gu, Bai, Xia Bai, or Yao Tong Shui 1, Yao Tong Shui 2, and Sanjiao 5, okay? I may also do 33.08 and 33.09, which are like mirror images to these special points here, or I may have the shoulder triplets in as well. So I'm working with anywhere from 3 to 5 needles in their arm when I do that. Go ahead and bend your knees so that your feet are flat on the table. Yeah. And I like to observe the way that they place their feet here and check the alignment there. It's good to have the feet aligned with the hips. She looks like she's a little narrow, but not bad. Her feet are lined up pretty good. We're going to take this foot out a little bit more though, so that it's more in line with her hip. So check their structure and alignment before you have them do that, because you'll notice that some clients, they might pigeon toe their feet in, or they might have an external rotation and their feet are out. So you want to make sure that when they do these series of movements that they have good structure and a good foundation right from the start. Okay, so after you've got the hand points in and you have them in this position, then you're going to want to have them do the bridge or to lift their pelvis off the table. So go ahead and inhale and lift up to whatever's comfortable. Don't move into any pain. Exhale and then drop your pelvis down. And then just do a few rounds of that. As they're doing that, observe the way that they're moving. I can learn a lot about their structure and about their condition when I watch the way that they move. Breathe in through your nose. Exhale and find a nice rhythm. Let's do 2 more of those. After I show them these movements, I'll leave the room and then let them do them on their own. And I typically instruct them to do 10 repetitions and then go into the next exercise. After they've done the whole routine, meaning the 3 or 4 different exercises, then I'll tell them to take a break and to stop for a few minutes, and then they can repeat it. So they're going in and out of movement with the needles in their hands and arm, and then they're doing 10 repetitions of each move and then taking a break in between the sets. Okay, so after we've done the bridge, the next exercise is to do the lateral knee drops. So exhale and drop to either side, and then look to the opposite side. So by doing that, they're getting a double spinal twist, which is therapeutic and very relaxing. Inhale and come up. They want to coordinate the movement with their breath cycle. So exhale, drop to the other side. Keeping good coordination with the movement and the breath. Inhale, come up. So you can see from these moves that we're targeting the low back and the hips from every angle. The first move puts the low back into extension. This works through the lateral line and the AB abductors. We get that nice stretch through the IT band. These moves go great with the needles in. And then these are things that they can take home with them as well. And that's where the real strength of this is that you're giving them movements, you're prescribing these as part of their healthcare program. This time as you come up, just leave your knees in position. And the next move from here is to do the butterfly move. So bring the soles of your feet together. Exhale, drop the legs out, and then inhale and bring them back up. So notice how we're getting stretch through the inner leg lines with this move as opposed to the previous one where the stretch was being isolated into the gallbladder meridian and IT band. Really simple movements. Even people that have really severe pain can start to do these. And when they have those needles in, you'll find that by doing these movements that they get much better results than if you just put the needles in and don't have them do any movement. Okay, let's stop there. Now, we've gone through those 3 exercises, so she can rest for a couple minutes now, and you can put your legs down if you'd like. So that constitutes the standard routine of 3 moves that I do. There's one other thing that I like to add to this that targets that superficial back line. That's to have them pull their toes towards their body and push out through their heels. So that's dorsiflexion. And then exhale and then point your toes towards the wall. That's plantar flexion of the feet. So we're starting to work into the back line and the muscles within the deep front line in the posterior compartment of the leg as well. Now, when you pull your toes back, push your knees into the mat, and you should feel a stretch to the back of your leg. Do you feel that? It's really gentle. Exhale, point your toes and push them as far as you can in that direction. That's going to contract those muscles in the lower leg that are involved with plantar flexion, and then this move is going to stretch that superficial back line. I've seen just this move work people out of low back pain when the needles are in the hands. So I do like to add this. We've got the previous 3 movements and now this one. I do that for 90-95% of my clients that have Taiyang and Shaoyang style lumbar and hip pain.